My name is Abaraogu. I'm a research fellow at the School of Health and Life Sciences, Glasgow Caledonian University. My research is into pain condition for individuals with long-term conditions. A common problem affecting about 2.7 million people in the UK is a background condition known as peripheral arterial disease. This happens when the arteries in the human body are clogged up with fat particles, and that results into decreased blood and nutrient supply to the muscles. Individuals with this condition get their leg fatigued or weak when they attempt to exercise or walk on their feet. These activities of exercise and walking bring them pain, which goes away when they rest, and we call this intermittent claudication. Among other things, it's important for individuals to take up to 30 minutes walk, but for people with intermittent claudication, this is a luxury. The knock-on effect of this condition is that individuals will go ahead to have increased risk of heart attack and stroke. Sometimes surgery are done on these individuals, but that is not the solution. It is important for individuals to get on their feet, take some exercises, and take a walk. It is important for the cardiovascular fitness. It's also important for other health outcomes, including mental health. However, exercises and physical activity is often limited in population with peripheral arterial disease and intermittent claudication due to pain. At GCU, we have been researching on ways to help these individuals to improve their physical activity and exercise behavior. We now know that educating the patient about the condition has lots of potential in helping them to imbibe and maintain physical activity and exercise. We also know that transcutaneous electrical stimulation, also known as TENS, has important role to play in helping with pain relief when individuals are walking. Pain is often elicited when they walk, like I said before. And how that happens is that fatty particles block the blood vessels, the artery in particular, and that leads to acid production. And that sends a pain signal through the spinal cord, and the brain perceives that pain. The individual with this condition often sees it as initial muscle weakness, cramping, and then the pain. We have shown at GCU that when individual with this condition uses TENS is able to produce a sensory stimulation that will go onto the spinal cord and block off sensation that's coming from the fatty acid buildup in the muscle. With TENS, these individuals are able to walk further, long distances, and not feel the pain. We also know that TENS can also work through another pathway by eliciting mechanism that makes the brain to send the body natural pain relief from the brain down to the spinal cord. With this instance, individuals also feel pain relief. So TENS work in two mechanisms. Either it blocks off the sensory stimulation at the point of the spinal cord, or it sends the body internal pain relief. TENS is described as a CE mark modality, and the implication is that you can get it in the local pharmacy. You can even order it online, or you can ask your GP or your physiotherapist. There's a whole lot of work that is still ongoing, but we know that TENS has potential to help people with intermittent claudication walk longer distance, increase their activity, and help them participate in the local communities